Hey, hello everyone. I'm Dr. Sharita. I'm your board certified emergency medicine physician and healthy lifestyle enthusiast and educator. I am also an Amazon best-selling author. I am a renowned speaker, and I am a new podcast producer. I know I've been missing in action and haven't been on here for a while, but I wanted to just come in and talk to you quickly about this epidemic or pandemic we have going on in our world today. I've been asked by, several family members and or friends to come in and just give my point of view on the coronavirus. And so I thought I'd put together some information and present it to you so that you can hopefully calm down, allay your fears, gain a better understanding of actually what we're dealing with, and just be able to go about this in a more informed and helpful way. So you might ask, what is the coronavirus? Well, coronaviruses are a large family of viruses that are named because they have spikes on the outside surface of the virus when we look at them under the microscope, right? And so they're named corona as a result of that. They were first identified in the mid-1960s. These coronaviruses are commonly found in humans or people, but they are also found in many different species of animals, namely camels, cattle, and bats, right? These coronaviruses are considered to be zoonotic. Well, zoonotic, what does that mean? That simply means that these viruses can be transferred from animals to people. Now, generally, that's not the case, but in these particular instances, if I could talk, the coronavirus is transferred from animal to people. So there are 7 types of coronaviruses that can infect us as humans. There are 3 types of coronaviruses that have been identified from animals that is known to cause infection in us humans. These 3 are MERS-CoV, MERS-CoV, and MERS stands for Middle Eastern Respiratory Syndrome. And then we have SARS-CoV, SARS-CoV, which is Severe Acute Respiratory Syndrome. And then we have SARS-CoV-2, which is this new novel coronavirus that we are currently being faced with. So this new COVID or new SARS-CoV-2 coronavirus was first detected in Wuhan City, China. This virus had never been detected in humans before, so it is new. And as a result of it being new, again, a lot of information is coming out and a lot of more research and stuff needs to be done to figure out exactly how to deal with it. So as a result of it, it has been detected in over 100 locations internationally, including here in the U.S. Excuse me. Now, just to delineate so you can get a better understanding, because I'm sure you've probably heard it used synonymously. You have SARS-CoV-2, that's the virus. COVID-19 is the respiratory disease that is caused by the virus. So COVID-19, CO is for corona, VI is for virus, and then D is for disease. 19 is because it was identified in 2019, first identified in 2019. So COVID-19 is the disease. SARS-CoV-2 is the coronavirus that causes that disease. And as you all know, we are now in a pandemic concerning the outbreak of COVID-19. So then you might ask, well, what is a pandemic? Well, let's go through some definitions. First, we'll start with community spread. Well, what is community spread? It means that it is easily spreading and sustaining in a community. That's community spread, something that is spreading easily and sustainably within the community. An epidemic is when an outbreak that affects people at the same time and spreads through several communities. That is an epidemic, right? And then a pandemic is when that epidemic starts spreading worldwide. And so those are the definitions so that you can kind of understand where we are. Epidemic, pandemic, community spread. That's basically what all of that means. So then how is SARS-CoV-2? How is that spread, right? Well, it's believed that it is spread via person to person. And what exactly does that mean? Well, if you're within 6 feet of a person, then you could be susceptible to their respiratory droplets if they cough or sneeze uncovered, and it gets out into the atmosphere and you inhale or, breathe in or happen to get those respiratory droplets that contain that virus in them in your eye, your nose, or mouth, then you can get it by way of person-to-person spread. They also know that it is spread via touching surfaces that have been infected by those respiratory droplets that somebody coughed or sneezed and it got on a surface, and then you came back by and touched that surface and then touched your eye, your nose, or your mouth, then that's a way that you could also introduce that virus to your body. Now, it is unknown how long these viruses last on surfaces. Excuse me. But again, because this coronavirus is new, so they don't know how long the coronavirus can actually last on surfaces. That's why we are pressing upon individuals to, clean surface areas. No, they don't think that it is airborne. But it can last on surfaces. It hasn't been identified as being airborne just yet. It's airborne in the sense that if someone sneezes in your direction, then yeah, you can get infected that way. So we have, a group of people that we deem high risk. And what does high risk mean? That means that they are at increased risk, if infected with the virus, of developing a more severe illness, right? So these high-risk people are older individuals, so grandma, grandpa, auntie, uncle, because usually older individuals have worn down immune systems or aren't as strong, as they used to be in fighting infection. So that's why they're in the high-risk group. We have individuals of all ages who may be immune compromised, meaning their immune system is not up to par and doesn't fight disease in the way that unhealthy persons would. So these are people with heart disease, with lung disease like COPD, with uncontrolled diabetes, people with cancer, people with kidney disease or failure, and also people who are recent or who are transplant patients, not even recent, but people who are transplant patients because they take medication that causes their immune system to not overreact and attack the transplanted organ. So all of these people are at increased risk because they are deemed immune compromised. We also have people like pregnant women and children who are also at increased risk. And then lastly, our healthcare workers. Healthcare workers are at increased risk because we are the ones who are on the front lines. We are the ones who have committed and devoted our lives to taking care of you when you're sick. We are the ones who are there when you come to us with your symptoms and with your illnesses and with your complaints and concerns. But that being said, we are also at increased risk because we're at the front door. So big ups, big shout out to all of my ER docs, nurses, and ancillary staff for holding it down. And as we continue to stay strong, as we continue to fight and combat this pandemic, we will keep you all in prayer, right? So just keep that in mind that, your healthcare professionals are at increased risk. That being said, I wanted to also say that if you find or think that you've been exposed to the coronavirus, or you want to go to the hospital or your doctor's office and get checked out because you have a cough, cold, sniffle, make sure you call ahead. Call ahead so that you can let them know that you're coming so that we can prepare. They have to make sure that the staff is fully aware that a possible coronavirus case is coming in so that they can get the staff ready and prepare the hospital for what needs to be done. They can take the necessary precautions. So also call ahead. So what can we do to prevent it? Well, hand washing for 20 seconds. You all have heard this, I'm sure, until you are nauseous. However, it is so vitally important to not just this infection or this disease, but so many others that we are faced with in our community. Hand washing goes a long way to improve or decrease the spread of germs, period. And it is, I can honestly say that this whole COVID-19, coronavirus outbreak, if it's done nothing else, it should cause us to pause and reflect on how lax we have become as a society when it comes to hand washing and taking those precautions. I mean, you shouldn't have to tell a grown person to wash their hands after they use the restroom, or wash your hands and disinfect after you sneeze or cough, or don't cough to them, people, or don't sneeze, or, you shouldn't have to tell people that. But, we get kind of, I think, laxed, and we start taking things for granted because, I don't know, you just do. So anyway, I digressed. However, if nothing else, this will cause us to come back to an awareness. Because when we are aware and we know better, we can do better. So anyway, hand washing for 20 seconds. That's the recommendations. So you want to get your soap. You want to wet your hands. You want to lather them up really good. You want to scrub. Get a nice lather and you want to scrub. You want to make sure you're getting in between the webs of the fingers. For us ladies who have nails, you want to get a brush and get up under these nails because a lot of germs can hide up under your nails. And you want to make sure that you're rinsing off under the water. And then you grab a paper towel. You cut the faucet off with the paper towel because it doesn't make any sense to wash your hands and then turn around and touch the faucet. It was funny. I was actually in, and this is an aside, but I was in a restaurant the other day, and now all of the workplaces are having their employees adhere to these precautions. But we still have a human factor because I was in there with a young lady who worked for the restaurant. She went in, she came out the restroom, she washed her hands, but she didn't wash them for 20 seconds. And that's a whole nother thing that we have to become conscious about. So they say, oh, well, sing the happy birthday song, or, quote your ABCs, or whatever technique you need to do. But you need to be washing for 20 seconds so that you can continue to disinfect your hands. Also, alcohol-based sanitizer. They recommend using that, containing 60 to 90% of alcohol. A lot of these homemade solutions, I'm not sure. If you can, I know it's hard to come by because as panic has set in, people have gone out and hoarded up all of the sanitizing equipment, or sanitizing hand sanitizer and wipes and different things like that. But hopefully they'll be restocking soon. So that you can make sure you get some. But if you don't have hand sanitizer, good old soap and water. Warm soap and water work just as good. So again, we might have to take that extra step to wash our hands, disinfect our hands, but doing that will prevent the spread of the germs and diseases. If you're sick, stay at home. Don't go to work. Again, I know that we got to get out and work. You got to make that money. You're afraid of losing your job. But again, hopefully in the interest of all of the coronavirus and the information that's coming out, maybe your employees will ease up a little bit and people will be smarter and more mindful about staying home when you are sick, period. If your kids are sick, keep them home from school. Because all we essentially do, we are a close society and we operate in close quarters and close proximity, but we're simply spreading the virus when we do that. You want to make sure that you cover your mouth and nose when you sneeze or cough. So we're recommending either with a tissue, covering your nose and mouth, or into the bend of your elbow. You want to make sure you do that when you're coughing or sneezing. And then also avoid touching your eyes, nose, or mouth or face. Now, oh my God, this is the hardest even for me, because I often throughout the day am always touching my face. Either I got a hair on my lipstick, or one of my eyelashes is twisted, or I got an itch here or there. That is the hardest thing, and I know, I get it. For us to, remember to do is to not touch our faces. But again, if you're mindful, over time we'll get used to not doing this. And when we say don't touch your face, it's mainly when your hands are dirty or you haven't disinfected. And so mainly if you wash your hands and disinfect, then maybe it might halfway be okay. But again, that's harder to keep up with, remembering all of that stuff too. It's enough to make us crazy. But we're going to get through it, right? We're going to get through it. So then, how can we prevent the spread of this disease? We can disinfect, right? You want to make sure that you're cleaning and disinfecting these frequently touched areas. Now, here's another thing that, we don't realize how many different surfaces and different things we touch throughout our day. Things that people frequently touch. So you have the elevator knobs. They said that those elevator knobs are nastier than toilet seats. But these are things, again, that we don't even recognize or think about. And do we wash our hands after every time we're on the elevator? Not then, but probably now, right? The escalator handles in public places. The equipment at gyms. Now, they have always had the little spray bottles and the wipes where you could go and clean down the equipment really good. But now more than ever, it's very important to continue to do that. So again, just keeping in mind that we have to disinfect certain areas that are touched frequently. This is being implemented in the workplace and in various places of business. Also in your home, you should be cleaning and disinfecting your home. Because we, again, touch a lot of different areas, go out in the public, touch things, and then come in. I know I used to, and I still do, when I pump gas, I use hand sanitizer. My sister actually uses a glove. So different people have different techniques because their gas pump is touched by so many people. So many people. So different things like that we may go out in public and touch the handles on different doors and different things. And then you come home into your house and you're touching different things. So let's just remember to take this time to disinfect our homes and in our environment so that we can continue to stay well and further help to hopefully decrease the spread of this virus and disease as well as others. The main thing, though, is to stay calm. Let's not panic. People have gotten all in an uproar because they're getting all of this information that they may not be able to process properly and not know how to perhaps handle it in the way that they should. And so the fear factor has run rampant through our nation. Yes, you have a right to be concerned, but you shouldn't necessarily be fearful because fear does nothing but make our situation work. It's added stress on our bodies and our mentality, and it just doesn't help us continue to live that healthy lifestyle and keep our immune systems from stressing the heck out, right? So what else can we do to prevent the spread of the coronavirus as well as others? Well, you want to practice good health habits. Well, what does that mean? Well, good health habits are things like a nutritious diet. I'll get on my soapbox about proper eating. Proper eating is key. A good nutritious diet is key in helping you to keep your body healthy. Eating and choosing the right foods. Cutting down on those sugary drinks, sugary foods, because sugar is not good for your immune system. So if you want a way to fuel up and boost up your immune system, eating a healthy diet can help you do that. You want to make sure that you're drinking plenty of water. Water helps to keep you hydrated. It helps keep your body flushed and detoxed. It helps to hydrate those cells so that they continue to work properly. So make sure you stay hydrated and you're drinking plenty of water. You want to stay physically active. Physically active. So all of this time we have off from work or our lifestyles are changing a little bit, let's stay active. Let's get into at least 75 minutes of exercise per week. Staying active is a good way. You can walk, run, swim, all of these things that you can do outdoors that may not involve necessarily in large groups, because a lot of people probably are now not going to the gym as often. But you can still get your workout in. You can get out and walk around your neighborhood. I see a lot of people walking around in our neighborhood. We get out and we ride our bikes. Well, of course, we're here in Texas, so it's probably a little warmer than it is for you guys up north. Shout out to my own people in Detroit. But that being said, again, you can find different ways, to exercise and stay physically active. You want to make sure that you're managing your stress. Keep your stress level at an all-time low. And so that's whatever that means to you. Meditation, yoga, reading, listening to music, whatever helps you de-stress, you want to make sure you do it. Now, some people have been watching this corona stuff on TV, and after a while, it probably gets to be too much. So it's okay to turn away. It's okay to turn it off. Turn on Netflix, look at Hulu, watch a movie, binge watch Empire series, or, whatever it is, to just break the monotony, because after a while, it can get overwhelming, and it can incite extra anxiety that may not even be necessary, right? So if you need to step away from all the news and all the media and all the coverage, then step away. It'll do you good, actually. And keep in mind, they're constantly updating information, because this is so new. They're constantly updating information. So then if you need to revisit and get caught up, believe me, you'll get caught up. It's out there. And lastly, you want to make sure that you're getting adequate sleep. Sleep is so key to the foundation of our health. It is key and it is important. You need to be getting at least 7 to 10 hours of sleep for most adults a night. Now, I know a lot of us don't get that. A lot of times I don't get it. I might get a good 6 or 7, but it is very important to make sure that you're getting adequate sleep. It is very easy to fall into the anxiety of the coronavirus and all of this. And do I have enough groceries? Did I buy enough toilet paper? What was that? That's a whole... Why is everybody buying up all the toilet paper? But anyway, so it's very easy to, get bogged down with all of that, tossing and turning, worrying about those things you can't control. Worry about the things you can control. Don't worry about the things you can't control, right? So get your sleep. Like I said, meditate, yoga, go for a walk before going to sleep, whatever it takes so that you can, again, to stay healthy and to keep your immune system working at its tip-top shape and at its best. Social distancing. So you guys know that we're currently practicing we should be practicing social distancing. Well, what is that? What is social distancing? Social distancing is an infection control measure or action that is implemented to help slow down or stop the spread of contagious diseases. And so we are currently trying to slow down or stop the spread of this coronavirus. It also helps minimize disease transmission, and it is done to protect those individuals who are at high risk. So make sure you understand that. It's not a punishment. It's not done because people don't know what they're doing. That suggestion is to keep us safe as a society and to protect those individuals who are at high risk. Yes, 6 feet is the recommendation when exercising social distancing when you're next to another individual. So right now we have a variety of schools that have closed. We have workplaces that have closed or have started many of their employees from working remotely or working from home to help cut down on the closeness of individuals in public. We have had canceled mass gatherings concerts and conventions, even local churches have canceled services in the worship house. I did church online today. We've always had online church, but it's nothing like going into the church house. But in lieu of the recent recommendations, we are practicing social distancing. And it's a good thing because, again, it keeps the infection from being passed from person to person or from person to object and then object to person. We also have instituted travel restrictions, which you guys know about. And people also are engaging in self-quarantine. So self-quarantining if you are sick or if you think you have the coronavirus or if you've been to those places that are on our high-risk watch list for coronavirus, then you need to be exercising self-quarantine. So then you might ask, well, why are we doing this? Why are we doing this? We are doing this because we are trying to basically flatten the curve. So there's a curve of disease prevalence that tends to go up as more people are infected. We do anticipate that because as testing becomes more readily available, that our numbers are going to go up. They are, but that's okay. We're trying to flatten the curve and decrease the amount and the rate at which those numbers go up. Because if not, it will overwhelm our healthcare system. And if our healthcare system becomes overwhelmed, then there won't be enough resources, there won't be enough physicians, nurses, ancillary staff, and people to help treat those sick people in need. And so we're trying to learn from places like China and Italy, who got bombarded with case after case after case as it started on an upward trajectory. And so by flattening that curve, keeping it from going up and letting it layer out, then you have less people presenting to the hospital system over time. And that allows us time to treat those people with the adequate amount of care and also get the resources that are needed, ordered, and then, brought into the hospital so that we can continue to offer care. Your equipment, so your mask and, IV fluids and other supportive things, ventilators that might be needed for the more severely infected. Hospitals only have a certain capacity as far as their ICUs go. So if the ICUs become overwhelmed, then, those patients spill over into the emergency department. Well, if the emergency department is overwhelmed with ICU patients, then there's no room to treat, other patients. And then decisions have to be made. Well, who gets ventilated on a machine versus who doesn't? Or, it's just so many other different things that we, again, are trying to flatten that curve so that we don't have to make those decisions or have those issues. It also allows time for a vaccine/treatment to be developed. Excuse me. By flattening that curve and giving more time as the scientists are out and doing research, trying to come up with the vaccine. So this is why we are doing what we do. And lastly, because it's the responsible thing to do. That's why we're doing it. It is the responsible thing to do. So let me ask you this question. Are you being socially responsible? Are you washing your hands? Are you practicing safe distances? Are you doing isolation when you are sick? Or if you've traveled to different places, are you removing yourself from the general public? These are things that we as individuals have to be socially responsible at doing. It is up to us individually and collectively as a society if we want to get this coronavirus under control. That is why the CDC and the World Health Organization have put out these recommendations for us to follow so that we can get a handle on this. It'll pass. We'll get over it, but we're going to go through it until we figure out the solution. And in the meantime, again, we just need to be diligent at being socially responsible and doing our part. Stop buying up all the supplies. Save enough for other people. Because, and I understand, fear and panic set in, and people, it's just survival of the fittest. So they're going to take care of theirs. But as a human race, we tend to band together in those times of need. And so you want to be able to lend a helping hand to your fellow brother or your fellow man, right? Do something nice for somebody. You know, help out a neighbor. If you have an elderly neighbor, you know, make sure you're checking on them to make sure they're okay. See if if they can't get to the grocery store and you happen to be able to go out, make sure you ask them if they need something. You know, we have to, this is when acts of kindness are so important. You know, we have a tendency, again, to be very survival of the fittest and very me, and mine. We want to hoard up everything. But it's also very important to look out for our brothers and sisters who might not be as fortunate. So I wanted to quickly just kind of go through some myths versus facts and just kind of dispel a lot of those myths that are out there. So the first one is a vaccine for COVID-19 is available. Well, currently, there is no vaccine for the new coronavirus, SARS-CoV-2. There is not a vaccine. The scientists are currently working diligently to try and come up with a vaccine that can be safely used in humans. However, this is many, many months from coming to fruition because they have to find it, test it probably on animals, and then make sure that it's safe enough to be used in humans. So in the meantime, we just treat you supportively. If you need, IV fluids or supplemental oxygen and that kind of thing, that can be given for those more severe cases. Then they will receive respiratory ventilation by way of machine and those kind of things. Just let me say that no, there's not a vaccine. This is a virus, so therefore antibiotics do not work on the coronaviruses. So you can stop asking your doctor or healthcare provider for antibiotics because it will not work on this virus or any other viruses. Now, if you happen to come down with a super infection caused by bacteria because your immune system was weakened, that would have to be tested, and then, maybe you would get antibiotics. But from the start, antibiotics do not work on the coronavirus. Next myth, you can protect yourself from COVID-19 by swallowing or gargling with bleach, taking acetic acid or steroids, or using essential oils, salt water, ethanol, or other substances. This is absolutely false and very dangerous to use any of those items that I mentioned. That doesn't treat or protect you from COVID-19, from the virus or the infection, COVID-19. So stop with all of that. Unfortunately, there's a lot of misinformation out on the internet, and we have a lot of internet trolls who tend to capitalize on our naivete or our fears. And so they come up with all of these things and they put it out there and they put it for sale in hopes that they will, catch you at your most vulnerable moment, and, you click and you buy, and it's not going to work. It is not going to work. So save your money, save your disappointment, save your heartache. Those things will not protect you from COVID-19. I'm sorry, from the coronavirus or from contracting or getting COVID-19. The best defense, as we have said, is a strong or healthy immune system and prevention. Another myth. The new coronavirus was deliberately created or released by people. This is false. Viruses change or mutate over time. So basically, that is what has happened with SARS-CoV-2. It was originally SARS-CoV, right? Back in the day when we had the SARS outbreak, if you guys remember that. Well, that particular virus mutated and became SARS-CoV-2. So no, it was not created in the lab. No, it was not released by people. This was a mutation or a change that normally occurs in viruses. Another myth. Ordering or buying products shipped from China will make a person sick. This is false. Currently, scientists are saying that viruses can't last long enough on these surfaces of these packages to cause this infestation or infection, especially when the transit time is days to weeks. They don't believe that it can last that long on the package surfaces. Data is constantly emerging, however, so if a case comes up or becomes known, then you will be informed. But as of right now, that is not believed to be the case. Another myth. A face mask will protect you from COVID-19. This is okay. Let me see how I can handle this. So, okay, the N95 mask is what is developed and used for us healthcare professionals to use as we treat individuals who are sick with respiratory illnesses and possibly sick with the COVID-19 disease. Healthy persons do not need to wear a mask. You don't. The mask, for several reasons. The mask has to, one, be an N95 mask. Two, you have to make sure that it is fit properly. So a lot of times the masks that I see people wearing, they don't fit properly. They have beards. It's not seated properly against their face. You know, so it fits poorly. The mask causes you to touch your face unnecessarily because you're adjusting it. You might get an itch and you're scratching your nose. And if you touch the surface that is infected and you have this mask and you reach up under it, you put yourself at increased risk by having the mask on, thinking you got a false sense of security. So, and also these single-use masks, they have masks and they're using them and they're reusing them. It is not advised that you reuse these masks. Masks are only for single-use disposal and then throw them away. So again, masks are not necessary for the healthy general public. Now, if you should wear a mask if you are taking care of anyone that's sick and possibly sick with COVID-19. So if you're a caretaker or a caregiver, if you are sick yourself and you happen to be out in public, then you want to wear a mask so that you don't cough, sneeze, and infect other people. That's with cough, cold, flu, regular flu, anything like that. You want to make sure that you are protecting yourself as well as the rest of the public. Okay? So again, we all don't need to go out and buy up all the masks as people have done. You don't need to pay $80 to $100 online for masks that are being sold because you don't need a mask. It's not going to help you unless, as I mentioned, you're in the healthcare profession or helping someone else who is ill. Another myth. Getting COVID-19 is a death sentence. This is not true. Let me just give you some statistics. 81% of people who come down with COVID-19 have a mild version of the disease. They manifest mild symptoms, maybe cough, runny nose. Some people who are infected with the coronavirus don't even manifest symptoms. Okay, so 81% who are infected might manifest some mild cases. 13% may represent, or 13% will manifest severe illness. So that might be where they need supplemental oxygen, or they might need, IV fluids and other medication to help and treat some underlying causes or problems. 4.7% of people who become infected with the coronavirus will become critically ill. And that might mean they need to be intubated, so that's placed on a respirator or ventilator to breathe for them, and admitted to the ICU. And then only 2% of individuals, 2 to 3% of individuals infected with coronavirus actually pass away from the disease. But again, a lot of times they have underlying illnesses or compromised immune systems that may lend to this demise. Okay, another myth. You can get COVID-19 from your pet. Currently, the World Health Organization states that the coronaviruses are not carried by household pets. So little Fluffy and little Moo, they can infect you, right? There have been no current cases of household animals causing Corona-19 or causing coronavirus infection in humans. So those are some tidbits I just wanted to share with you. So again, hopefully to inform you, enlighten you, and allay your fears. What could be some of our best practices going forward? We want to first and foremost stay calm. Staying calm is the best way. Don't panic. Stay informed, okay? New information is coming out every day. So just stay informed so that you are in the know as to what is needed and what is necessary. You want to make sure that you are flexible, okay? Be flexible and adaptable. Again, this is an ever-changing new infection and new pandemic that is upon us, and we are learning each day as you are learning. And so be flexible and be adaptable, because changes may come in your workplace. They may come as they have. See, I just scratched my nose. But my hands are clean. But they may come as they have with changing how we do, holy worship, and changing how, you go to the grocery store. At one point they were rationing the amount of people they were letting in because the stores were being bombarded by so many people. And so even standing in line, practice social distancing, right? But staying calm all along the way. You want to make sure that you remain and continue to be socially responsible. Let us all do our part with proper hand washing, disinfecting, preventing the spread, staying at home when we're ill or sick, and just doing our due diligence. Now, I know it's hard. We're all getting cabin fever. The kids are out of school. They're busting at the seams. But get creative. Utilize this time to spend precious time with your family. Something that we probably rarely do as we rip and run throughout life. Let's take this time to really enjoy one another. Catch up on a good movie, or play some board games with your family, or go out for a walk, or play in the backyard. Become reconnected with those things that we once enjoyed. Okay? So very important. Make sure that you stay healthy. Staying healthy by eating the right nutritious foods, drinking plenty of water, continuing to stay active, and doing those things. Social distancing, I know that kind of makes us feel a little isolated, and it can be depressing at times. So, call your friends up on the phone. Call them up on the phone or text them, or maybe you can even do FaceTime. We have to utilize technology as it is beneficial to us. So you can FaceTime your family and friends just to stay in touch. You can FaceTime your coworkers if you're missing them at work. But let's just do what we can to continue to remain diligent and dedicated to combating this pandemic, to bringing it under wraps so that we can get back to life as we once knew it, right? And lastly, I don't know if you're faithful, if you believe in a higher being or power, if you believe in God, Jesus Christ, but let's stay prayed up. Let's stay prayed up, okay? Because then that will help you gain a better understanding and hopefully get through this pandemic with ease, right? So let me look through some of my comments and questions that people have posted and make sure that I addressed many of them. And I'd like to thank you guys for watching and joining me. Hopefully I have educated you and enlightened you. And if you have any other questions, you can post below and I'll try and get to them. Okay, I answered that. I answered that. Okay, very good. Let me see. Is there any other questions? I'll go down to the bottom quickly. No further questions? Well, hopefully if you're just joining and you missed the talk, then you can go back and hand wipes. What is your question about hand wipes, dear? Can you use hand wipes? Well, yeah, disinfectant hand wipes. So they have, oh, you mean the baby wipes? Well, I don't know that the baby wipes are contain the proper amount of disinfectant. They're mainly for cleaning, but I mean, anything helps better than nothing. If that's all you have, then yeah, you can use it. It's okay if that's all you have. But again, soap and water works best. If you can get to a bathroom that has soap and water, then that will be best. I know they do have some Clorox wipes, so if you can get your hands on some of those, then maybe you can use the Clorox wipes. But again, I don't think the baby wipes are sufficient enough. Okay? Any other questions? Again, share this video with your family and friends, anybody who you think might want to know a real down-to-earth, straight-to-the-punch kind of understanding for coronavirus. I didn't go through a lot of the information that has been out there, like the symptoms, you know, and different things like that, because we've been over that ad nauseum, right? But I just wanted to bring to you some of those things and just break down and, you know, give you some definitions so that you can gain a better understanding. Because when we know better, we do better, right? So God bless. To all of you, stay healthy, stay informed, and have a good night. Take care. I'm Dr. Sharita.